Welcome, everyone. Thanks for joining us. We're going to get started right at 1 o'clock, so feel free to grab something to drink, grab your lunch if you need to, because we have a couple moments. And feel free to introduce yourself in the chat if you like. All right, good afternoon, everyone. I think we'll probably have some more folks filing in, but we're at 1 o'clock and we know many people took time out of work and caregiving to be here, so we'll get started right on time. Thank you so much for joining the RAFT webinar on caregiver self-care and resilience. Just a few webinar housekeeping things before we get started. All the participants on the webinar today will remain muted throughout the time, but we do want to hear from you. So please put your questions and comments and any thoughts that you have in the chat. We are recording, and the recording, as well as a copy of the PowerPoint, will be sent out to all participants and registered attendees. So if you weren't able to join us live, thanks for watching the recording. You will get the information as well. And just some expectations as we go through the webinar. We know folks are going to be sharing some information maybe about your journey, about caregiving in the chat. Please just share whatever is comfortable for you. And, we are coming to this work from our work experience working with older adults and caregivers and folks with dementia, as well as some family experience. But we definitely don't have all the answers. You guys are the experts in your own situation, but we just ask that you be open to some new ideas and perspectives as we go through this. So just to start out, we'll introduce ourselves, and feel free to introduce yourself in the chat. My name is Sydney Palinkas. I am with RAFT. I am the Dementia Education and Outreach Coordinator. And Emma, do you want to introduce yourself?
Sure. Good afternoon, everybody. My name is Emma Mailer. I'm one of the dementia support specialists with the RAFT Dementia Support Team.
Narisha?
Good afternoon. I'm Narisha Hall. I'm one of the dementia support specialists as well.
Thanks, Narisha. And Vernice, I'll let you introduce yourself and hand it over to you for the first couple slides.
Okay. Good afternoon, everyone. My name is Vernicia Bell, and I'm one of the mental health therapists with the RAFT program.
Okay. Do you want to introduce the clinical program?
Sure. So the RAFT, the The RAFT clinical program is a program with the Regional Projects Office, as we serve all 5 counties in the Northern Virginia area. The program was first started providing services in 2008. We support older adults who have a serious mental illness and or a dementia with challenging behaviors diagnosis. We help to discharge people from Piedmont Psychiatric Hospital and get them back into the Northern Virginia area into either a nursing home facility or assisted living. Right now, our success rate with keeping people out of the hospital is 98%. So what the clinical program does, we contract with different facilities within Northern Virginia area, assisted living facilities as well as nursing home facilities to provide services. We provide intense services to the residents that we have there. We provide on-site support as well as virtual support. In particular, like during the pandemic where we weren't able to go see our clients, we were able to still provide services to them. The criteria for our program, you have to be 65 and up, and then also a resident of one of the 5 counties in this area. And like I said before, have a diagnosis of a mental health disorder or dementia with challenging behaviors. And also be at risk of psychiatric hospitalization, or you're already hospitalized at Piedmont Hospital, and you require treatment to follow up to help manage your illness. And in order to make a referral, all our referrals are come through the CSBs. So these are all the different representatives that we have within the area that you can contact regarding a possible referral for our program.
Good afternoon again. Again, I'm Narisha. I'm going to talk about the Dementia Support Program, which is a short-term free program. It's supporting individuals living with dementia and their families in their homes. So you have to be living in the community. And we provide education and support to families and build caregiver resilience and reduce stress. Our service, we are trained dementia support specialists, so it is 3 of us, and we work with families to assess and identify challenges or areas of concern. So we hate to say like challenges, so areas of concern. And we provide individualized education and training on topics such as the overview of dementia. So we go through the types and the stages of dementia, work on communication or how you communicate with your loved ones, how to make them stay safe, and also provide them resources on how some organization that can come in regarding just to evaluate your home regarding safety. We talk about and educate families and caregivers on wandering and other challenging behaviors. We connect them to resources and other services in the community. We use non-pharmacological interventions, and we plan to prevent crisis. And we do have a program, a respite program in an assisted living facility. Some of the eligibility requirements, you have to be a resident of the city of Alexandria, Arlington, Fairfax Falls Church, Loudoun, or Prince William County. You have to be 55 years or older, diagnosed with dementia or exhibiting signs of dementia. And we do help families and caregivers coordinate and try to get that diagnosis. And you have to be living in the community in their homes or homes with family members or other caregivers. And anyone can make a referral. You can make a referral to Sydney. Her email address is there. You can call or you can go online on our website to make a referral. RAFT also offers free consultations to professionals and families, free trainings to community members and professionals. So a little question I'm posing, you can put it in the chat. So what difficulties do you face as caregivers, or do you see others face? So it can be like, someone that that may be facing some challenges. And you can put it in the chat. So I see someone said knowing how to access resources. Yep, self-care. Any others? Not knowing about the resources or how to navigate. Yes. Lack of finances. Yes, these are a lot of things that caregivers do and difficulties that caregivers face in the community. So some of the common struggles that caregiver face is like someone said, financial constraints, not enough help, your loved one saying mean things to you or accusing you of things, resistant to care. Sometimes we feel alone that we don't know where to go, where to turn, so we're just feeling alone. A lot of guilt, not having time for self-care. I think someone said self-care, and also not having enough sleep. And if the caregivers can't take care of themselves, you can't really be fully there to take care of your loved one. And I do see a couple more responses coming in. So yes, resources, but no actual help. Yes. Let's talk a little bit how stress can trigger a variety of physical, emotional responses, which is a part of our natural body, which is fight, flight, or freeze. I know everyone heard of fight, flight, and freeze, which is a response to perceived threats. So fight, for example, is the way a body is preparing to confront a fight or a threat. So some of the physical symptoms may be like rapid heart beating, clenching of your fists, muscle tightness, or surge of adrenaline. And mentally, you may feel a little bit more aggressive or confrontational, or sometimes an urge to solve that problem immediately. So the fight response is the way how your body is escaping danger. Some of the symptoms may be like rapid heartbeat, um, rapid breathing, sweaty palms, or feeling like restless or have like anxiety. And you may feel an urge to run away from the situation or actually like avoid facing it. And your mind start racing and you're trying to figure out a exit strategy. The freeze response in some situation when your body may freeze is a way to to avoid detection or not being harmed, which you just basically freeze up. You feel stuck. And sometimes you're not feeling or thinking clearly, and it may manifest in symptoms such as shallow breathing or tension or numbness, which is really important that you know your own body warning signs of stress.
Oh, Narisha, you muted.
I don't know. You know what? Sorry about that. So how can caregiving affect you physically? And you can put it in the chat. Someone said earlier, lack of sleep, lack of, so when you're having a lot of lack of sleep, it shows up, you may have headaches, may have an upset stomach, your body ache, your tense muscles, which are, some of the fight, flight, and freeze, frequent infections or colds, or I can't get rid of a cold, jaw clenching, grinding of your teeth. Yep. High blood pressure, constant tiredness, over or under eating. I know sometimes when I get stressed, I tend to eat a little bit more. And then also increase of use of alcohol. And also in the chat, like how can caregivers affect you mentally? Caregiving affect you mentally? And you can put this in the chat. Worry, energy, anxiety, yes. Yep, always thinking about the loved one, yes. Forgetfulness, trouble concentrating, thinking, feeling and having negative thoughts, feeling out of control, mood swings, not feeling like yourself, emotionally numb, sadness, anger, or grief. Yes, not enough time. How can caregiving affect your behavior? I know sometimes, we tend to procrastinate on things, canceling plans with others, gambling, shopping, short-tempered. Yep, that's a good one. Binging on television or social media, increase the number of accidents and mistakes when, things that you normally would do, you tend to make mistakes on them. Isolating yourself. Yes, overthinking, canceling appointments for yourself, feeling distrustful. Yes, calling out for work. Any other examples that you guys can think of that is not on this list?
So today we're going to be talking about self-care and resilience. And self-care and resilience are really connected. Self-care helps us build our resilience. That's not a word that you've really heard in this context before. Resilience is the ability to recover from or adjust easily to misfortune or change. That's the dictionary definition. I think of resilience as our ability to adapt and bounce back from challenging situations that we face. And how we do that is by building up our resources, our skills, and strategies that help us adapt and come back from a challenging situation. So today we're going to talk about some tips, hopefully help you build that caregiver toolbox so that when you're feeling burnt out, tired, exhausted, worried, that there's something that maybe you can draw from to help you get through that moment and keeping the fantastic caregiver that you are. If you want to throw in the chat, what helps you be resilient as a caregiver? What is a skill or a support that you have that helps you when you're feeling really stressed or really low? That can be like a family member or a friend that you can turn to in your rough times. That can be like a skill that you have in yourself, like a sense of humor, um, dedication, having a supportive team. Definitely, Julian. Having a supportive team makes all the difference. Deep breathing, taking a walk with friends, talking to friends, definitely. All those outlets that help you take a moment for yourself, collect yourself, reflect, and move forward. Those are excellent examples. Yoga and meditation, fantastic. So we'll be going over some tips for building caregiver resilience. I believe we have 15 tips. Again, something to help you build that caregiver toolbox. Tip number 1, gosh, so much easier said than done. Ooh, being in my art studio, that's another way to build resilience. I love that. Going back to tip number 1, trying not to feel guilty about taking care of yourself. Caregiver guilt is such a challenge. It really can manifest in different ways. Guilt that I'm not spending enough time with other people in my life because I'm caregiving. Guilt that I don't feel like I'm doing a good enough job. Or sometimes guilt about the decisions that you have to make to take care of your loved one. We recommend is taking a moment to consider how you currently take care of yourself. Physically, emotionally, mentally, spiritually. What are you doing to make sure that you have the energy and strength you need to continue caregiving? The metaphor that I like, maybe you've heard of it before, but when you're on an airplane and they're doing the whole talk in the beginning about your safety, they always tell you that you need to put on your oxygen mask before putting on someone else's. And that's true for caregiving too. If you're drawing from an empty well, then it's going to be more difficult to provide care for your loved one. Not only that, but you're a human being too and also deserve care, time, and attention. Another thing to think about is reflecting on what are you doing now. If you didn't make any changes to how you take care of yourself and 3 years go by, what would that look like? Would you be more stressed? Would you be more burnt out? Do you need to maybe try and make some changes to help you maintain your resilience? What would that mean for you if you made some more changes? And what would that mean for your loved one? More stress, definitely. Tip number 2, knowledge is power, which is how RAFT Dementia Support Program can also be helpful, because a lot of what we do is education about caregiving dementia for caregivers. Big thing for dementia especially is oftentimes people get that diagnosis, that life-changing, difficult diagnosis, and there isn't necessarily a lot of follow-up on the medical end of things. It leaves people saying, okay, my loved one has this diagnosis, what do we do now? Like, what does this mean? There's a lot of, research, informational resources that exist, both online, library. I'm a huge proponent for support groups too. It's a fantastic way to learn more. But knowledge can help you prepare for the future, anticipate what challenges might be coming down the road, and make plans for how am I going to support my loved one? How am I going to take care of myself when this new symptom or new change develops. And if you're interested about learning more about resources, education, you can always reach out to us too, and we can help get you connected. Tip number 3, another thing that's so much easier said than done, is trying not to take things personally, especially when it comes to caregiving for someone with dementia. Part of the dementia symptoms can be your loved one has less of a filter, and sometimes it can also be personality changes connected to them having more confusion, not understanding what you're trying to do, not understanding that you're trying to help. And that can lead to people with dementia lashing out, saying mean things, saying things that they would not have said to you back when they had a healthier brain. And that can be so difficult, especially when you're trying to do everything that you can to make sure this person is cared for and safe, and you're getting that negative feedback. What can be helpful sometimes is reminding yourself, okay, it's not the disease, it's not the person speaking, it's the disease that's making them say these things. On the other hand, sometimes when you're caregiving, you might get a lot of feedback from other folks who aren't involved in the caregiving process, making suggestions for things that you might do differently. Feedback can be really helpful, sure, but also realizing, I'm taking care of my loved one. If I'm getting some negative, feedback, I'll take stock of what's said to me, but I also know that, I feel confident in my decisions as a caregiver. Remember, unless someone has been a caregiver, they won't ever really be able to understand what it's like day to day. Tip 4, choose your battles. Patricia had a great comment. Never argue with a person with dementia. You'll always lose and get frustrated. So true. As you're taking on these caregiving responsibilities day to day, ranging from, everything from medication management, making the meals, making sure your loved one is dressed and clean, it's a lot. And sometimes, especially with dementia, there can become pushback when you're trying to assist your loved one. What's important is trying to save your energy for important things. So thinking, in this conflict, is it a matter of their safety or dignity, or is it something that I can let go? One example I use is I was working with a caregiver, and every morning she'd try and put on her dad's socks, and every morning he would try and kick her and refuse to put the socks on, and it was a whole thing. It would like set the mood for the rest of the morning. One thing I asked was like, well, is it that important that he needs to wear socks? Is it possible that he could wear the shoes without socks, especially if it's such like an issue? It's like, yeah, okay, that's something I can let go. That's a battle that I can choose. Again. And then, oftentimes with dementia too, our loved one might be saying things that aren't true. Misremembering things, misremembering names, people, all that stuff. And sometimes, even though we're coming from a good place of trying to correct and orient the person, it can lead to sometimes more agitation, more pushback. So certain times it's good to think, okay, do I need to correct them, or is it just going to upset them? Maybe I can instead join their reality, and that might be a better way to keep the peace. Tip number 5, rethink your approach. You know your situation, your loved one best, but can you consider things from another perspective? Again, kind of going back to that sock example, if the thing I'm trying to do every day is not working, what might I try differently to hopefully have some success? I think one area that this is a approach to reflect on is medication management. So often I speak with caregivers and they're like, I'm trying to give my loved one their medications that they need to make sure they're not in pain, to help them, and they're refusing to take them. And then we worked together to really brainstorm, like, what might be a different approach we might take to make this more successful. If me just giving the medication to my loved one and saying, here, take these pills, isn't working, how might we, either change the time of day if possible, change the method the medication is given, change what we say to hopefully make this more successful approach. It's a lot of experimentation. What I suggest too is keeping note of things. If you're noticing certain behaviors from your loved one, it can be good to keep track of when this behavior is happening, what's happening right before the behavior that might be triggering it, how am I responding, and how is my response having an impact. Really help you reflect on, okay, what approaches are working and where do I need to go back to like the drawing board and try and think of a new perspective to take.
Yes. Thanks, Emma. I'm going to pick it up on tip 6. And this is something I know I personally struggle with. So I don't know if anybody else on the call has this problem, but kind of expecting perfection. But we have to remember that when it comes to caregiving and really life in general, there is no perfection. So there's no such thing as the perfect caregiver. I think we sort of do have this idea sometimes in our minds of what a perfect caregiver would do and the sacrifices that they would make. And, they would never need any time for themselves and they'd never lose patience and they'd find all the resources right away. But that does not exist. So there is no perfect caregiver, no perfect spouse. There's not going to be, perfect solutions to some of the challenges that we face with caregiving and with dementia. Sometimes there's things that are better to say than others in these situations, but there's really no perfect thing to say, no perfect way to handle any of these moments. And I love this quote, perfection isn't what matters. In fact, it's the very thing that can destroy you. And I think sometimes focusing on what things look like and that perfection can hold folks back. I know I've heard of caregivers trying specifically maybe with eating, turning to feeding their loved one because they're starting to get kind of messy when they eat and they don't want that to look messy and to be messy. So they start feeding them when maybe that person could have had a little bit more independence for longer. It just would have been a little bit messier. So just to be lighthearted here, I say, sometimes we're trying for that super perfect picture in life, and then we end up getting this instead. But that is totally okay. And Patricia says, improve your improv skills, learn to pivot and not be attached to outcomes. Yeah, absolutely. That's a great tip, especially if you're thinking of activities with your loved one. It's not always about the outcome of the activity. It's about the journey. All right. Tip number 7, really giving yourself permission to feel your feelings. There's a lot of different things that can come up with caregiving. We talked already about guilt, but there could be grief, feeling, sadness over your caregiving role or the loved one that maybe you haven't lost yet, but that relationship is so different. So you might be starting to sort of grieve that person in that relationship already. And then there's some emotions that maybe don't feel as nice to feel, but that's still okay to have them, right? Like maybe there's some moments where you're feeling jealous of other people, friends in your life who don't have this role and this responsibility. Or those moments where you're thinking, you know what, this is not what my retirement was supposed to look like. We were supposed to go on trips together and to have some of that disappointment. Because if we don't ever sit with and feel some of these hard feelings, you can't really ever move through them. So, having some time to talk with someone else, support groups, as Emma said, are awesome. Writing in a journal, spending some time alone, anything you can do to really focus on your feelings so you're able to get past some of the hard pieces. Right. Tip number 8, asking for help. So for some of us, we know we don't necessarily have that support system, but for others you might, but they don't always know when or how to help you. So the first step is remembering that it's okay to ask for help. You don't have to do everything. Just because you're someone's caregiver, because you're their spouse, their loved one, does not mean you have to take on every single role, every single part of all of this. It's okay to have help for different parts and to say, you know what, this part is really hard for me and I need someone to come in, or I'm going to need some time for myself. And I think often I hear people say, I'd love to help them, or, let me know if you need any help. And we see caregivers just kind of push that aside of, okay, sure. And then they never follow up. If you're able to give people really specific things that they can help with, I think that is helpful for the helpers, saying, you know what, dad actually has physical therapy on Tuesday evenings. That'd be a great time for me to be able to just be myself. Could you drive him every once in a while on Tuesdays? Or cooking has actually been really challenging in finding the time. Would you mind every once in a while bringing over some leftovers? That would really help us out. Giving people really tangible tasks can help them help you. And oftentimes people do want to help, they just don't know how to. All right, finding respite. So maybe you've got to the point where you're saying, okay, I want some help, but what does that actually look like? So there's lots of different forms of respite. This could be in-home care, maybe through a private agency or a private nurse. And we're happy to help connect you with lots of these different resources. Adult daycare programs, there's ones through the different counties, as well as some private programs in Northern Virginia. There are short-term respite stays at nursing homes, assisted livings, or memory care, or checking in with friends or family. So RAFT is a good resource for this. As Arisha talked about in the beginning, we are able to provide free respite care in an assisted living for up to 30 days for our clients. So if that's something you're interested in, please reach out to us. There's also the Virginia Lifespan Respite Voucher Program, which offers, I think it's just under $600. So, a decent amount of money. You can take a little bit of time for yourself, and that can be used for any type of respite care. And then the guide model, which is a new program funded through Medicare Part A or B, also has a respite component to that. So if you're interested in learning more about any of those options, please feel free to connect with us. Oh, perfect, Emma. Emma also put in the chat the Hilarity for Charity respite grants. And I can tell you they're actually pretty responsive with those grants from my experience. All right, and tip 10, finding humor and joy in your day. We know that caregiving can be really difficult. Dementia can be really difficult. There's a lot of hard moments, but there can also be some really funny, silly, goofy moments and things that happen during this time. So, making sure you're taking just a little bit of time to notice that joy, notice that humor. The funny, goofy, I kind of say like the ridiculous parts of dementia and caregiving, because sometimes it can be heartbreaking, but in a way that also makes you smile and laugh. So take a moment to appreciate those times as well, and appreciate that time that you are having with your loved one. And I will hand it over to Vernicia for our last few tips.
All right, thank you, Sydney. Tip 11. I'm sorry. Make self-care part of your everyday. I think a lot of times when we think of self-care, we think it's something big or major, like, oh, you go into a spa, something like that. But there are ways that you can kind of incorporate self-care in your everyday part of life, like exercising, not skipping meals, not skipping sleep if you're able to. Even taking time to kind of just snuggle with your pets, and being able to separate the two, because a lot of times with caregiving, especially if you're working while you're caregiving, being able to separate it and kind of just leave work at work, and when you're home being the caregiver, being able to take care of those responsibilities there. And then sometimes it's okay to unplug and have time without electronics. So being able to just kind of take that time to kind of breathe and relax. So finding ways every day that you can kind of build in little things that you can take care of yourself. Tip 12, make your self-care plan. So being able to ask yourself things like, who can I call on when I need help? Because a lot of times when you're the caregiver, you kind of feel isolated, but being able to develop a support system to kind of help you along the way could be helpful. Reminding yourself, not feeling guilty if you feel too busy, if when you're not able to take care of yourself because you're too busy helping to take care of somebody else. Um, how can you hold yourself accountable? How can I hold myself accountable to be able to step back and take time for myself during this caregiving process? What ways can you kind of hold yourself accountable in the midst of that? And what is one quick way what is one quick thing I can do to kind of help calm myself down? Is that just taking a moment to just breathe or whatever it may be? So asking yourself these different questions to kind of help you to come up with a self-care plan. So tip 13, I know earlier Narisha talked about the sympathetic nervous system, but I'm going to talk about the parasympathetic nervous system. This system is totally different. This system is the kind of relaxed system. It's the system that helps our body kind of rest. Um, and things like that, and ways that you can kind of activate the sympathetic system. You can do deep breathing. You can do meditation. I know somebody else earlier pointed out you can do yoga, getting a massage, just sometimes taking a walk, like getting out in nature and things like that. Those are all ways that you can kind of activate the parasympathetic system that because a lot of times with caregiving, you can feel overwhelmed and anxious and things like that. So being able to tap into that other system to kind of relax yourself. Tip 14, practice gratitude. So gratitude has been, when you're able to practice gratitude, it has been shown that it can help lower stress and anxiety levels. So being able to point out, what did I do well today? Because we all mess up and have mistakes. And like Sydney was talking about earlier about the whole being a perfectionist. So being able to identify, what did I do well today? What are some acts of kindness that I witnessed or I received today? And being able to look at a stressful situation through a different lens, through a more positive way, can be helpful. And what are you looking forward to? So being able to identify these things, like just taking a moment. I know some people do gratitude journals. Some people have a gratitude jar where like maybe once a day you just kind of write down something small that you're grateful for to kind of help change your focus from all the points where you're feeling overwhelmed and things like that to being able to help you to identify more positive ways. And then practicing mindfulness. With mindfulness, you want to be able to focus on the present because we get so overwhelmed thinking about what's already happened or being anxious about what's to come. But being able to just kind of sit in the moment of where you are right now and be like, it's okay right now. I'm okay right now. Things are in this moment, everything is okay. So being able to take that time to do deep breathing, do body scan meditations. I know a lot of people use YouTube to find different deep breathing exercises, to do different meditation exercises. Um, I even, with some of my clients who may not be able to do long moments of meditation, they have meditations where you can do deep breathing and things like that for even 1 minute. So being able to take that time to be able to kind of center yourself to the present and paying attention to your senses is one where they tell you to be able to identify 5 things, like what 5 things can I see? What are 3 things I can touch? What are 2 things I can smell? So things like that, being able to just kind of focus on the present. And then being able to treat yourself like a good friend, the way you would, talk to a friend and things like that, you kind of talk to yourself that same way to provide you that support necessary. So a quote that we have that kind of sums up a lot of this. I think it's cruel to expect a constant presence of one family member. Just as we have to breathe in and breathe out, people have to recharge their batteries outside of the sick room at times, live a normal life from time to time. We cannot fully, efficiently, in the constant awareness of the illness.
Right. Thanks, Bernicia. And to close out, added a quick grounding mindfulness exercise. So someone actually just put in the chat, what is walking meditation? So walking meditation is very similar to kind of what Bernice was talking about in terms of mindfulness. It's really, as opposed to walking and chatting on the phone or listening to an audiobook, which I do all the time, it's maybe walking down your street or even just in your home and focusing on the feeling of your feet on the floor and the birds chirping and just being really, really present in that moment and focusing on your breath. So if you have a moment, we're going to have some time for Q&A at the end, but take some time to do a quick little mindfulness exercise. So if you want to just get comfortable in your seat, I'm actually going to do the one that Vernicia mentioned earlier. So take a moment here to look around your space, wherever you are, and notice 5 different things. Maybe 5 things that make you smile. When you have those things, go ahead and close your eyes. Continuing to breathe deeply as we go, and notice 4 things that you can hear. Be birds outside, you hear a train in the background. Maybe you're in a quiet space, so there's not a lot of things to hear, and it's just my voice and the sound of your own breath. And then 3 things that you can feel. Yeah, that could be, reaching out to touch something, or even just noticing, the feel of your shirt on your body, the feel of the chair coming up to support you underneath you. Maybe you didn't have lunch yet, so the feel of hunger in your stomach. Two things that you can smell. Your shampoo or perfume. You did have lunch already, maybe you can still smell that. Flowers wafting in from outside. And then last, one thing that you can taste. This one's always a little bit harder if you don't plan for it. So if you're going to practice on your own, this could be a time when you grab a mint, take a sip of a nice tea, and just notice something that you can taste. All right, so as you flicker your eyes open, come back to the afternoon. I'm gonna put a slide up with some resources, but then I know we also had some questions and comments in the chat. So I'm gonna go ahead and highlight some of those. Emma, I know you've been watching the chat. There was some in the Q&A as well. Is there anything that you wanted to highlight in the chat?
Yeah, well, Angie asked if we could help develop an exercise routine for her. If you've seen how often I exercise, you wouldn't want me to develop a team for you, but we could help brainstorm ideas. Sometimes that can work as if there's like an exercise program maybe your dad could participate in, then maybe you could do it together so it's helpful for him, but also maybe helpful for you. Gosh, that's a good question though. I'm not sure, maybe there might be video resources or uh what else? Like online resources with suggestions for caregivers about exercise they might try. Um, and then Mary Jane had asked, any suggestions when you're alone and no longer a caregiver after decades single parenting, grandchildren care, and finally parent care while working full time, and now left with all the parent stuff, their home, other family members' stuff, and you're working full time, and there's just a lot of stuff it sounds like you need to sift through. Any suggestions for that? I was thinking, there are decluttering services if you're talking like physical stuff, that could help you go through some things and provide some guidance. What are other folks thinking?
Looks like someone put in the chat, maybe delegating to a girlfriend or a professional or someone else in your life who might be able to help you kind of go through some of that stuff. And Mary Jane, I see question about specific services. I think we do have some specific decluttering services. So if we can gather.
I'm looking through my email right now, trying to find their name.
Okay. And we can also email you after some resources as well. So someone had put in the Q&A, and I just wanted to lift up this comment because I'm sure it's one that a lot of people have, and see if there's any suggestions. Someone says, loved one says something nasty. My brain knows this comes from a damaged brain, but I still have an emotional response. I need suggestions for managing my emotions. Any thoughts on that of how to not always respond with that emotional response when we know rationally? Angie says, if you can, try to count to 10. Yeah, I think, it's interesting with dementia, we know that people lose that logic part of their brain, which is why arguing with people doesn't ever get us anywhere. But we also lose that logical part of the brain when we're stressed out. So making sure, you are taking care of yourself and just, taking a moment. It's okay to step out of the room, step outside, do, something that you need to do for yourself for a moment before responding in those moments. Yeah, and she said, my dad says nasty and untrue things all the time. I'm learning not to respond.
Yeah, definitely making space if possible. I think one, it's totally natural to have an emotional response. And anyone insulting you, saying something nasty is going to have an emotional response, and it's totally okay for you to feel bad. I think making space can be really helpful. Like Mary Jane said, like, okay, I'm going to step away for a second and collect myself. Having an outlet, be it like talking to a therapist, a professional, or just talking to friends, family, a support group can be really great too, because those are people often going through the similar things to you. I can put it in the chat, some virtual support groups through Insight Memory Care Center based in Fairfax. But I think that can be really helpful too, to just talk to people who get it and are going through similar things and can provide support to you. Journaling, just any way to kind of process what's going on, because it hurts when you're caring for someone, doing the most that you could possibly do, and then you're getting that negative feedback. So I really recommend having some kind of outlet and folks that you can talk to.
And thank you, Narisha, for anyone who didn't see it, did put some some more resources for Thumbtack and Angie's List in the chat for reliable service providers for decluttering, organizing, and other types of projects like that. Any other questions, comments? Scrolling through the chat here to make sure we didn't miss anything. Also, always welcome to call or reach out to us other times. Yeah, Senior Navigator, Nurse should just put that in the chat, is also a really awesome resource if you haven't ever checked that out for finding services in your community. So we will send this PowerPoint out, so you will have all the links on this slide. Again, if you're interested in making a referral or even just talking more to us at the RAFT program, please feel free to reach out anytime. We also do, as Narisha said, free consultations. So if you're not quite sure that your situation fits the RAFT program, we're happy to just jump on a call or do a virtual meeting with you. Great. Thank you all so much for spending the time with us. Hopefully, if you carved out the full hour to spend with us, now you have 12 extra minutes to just breathe and take care of yourself. Thanks, everyone.